Hello, and welcome to Shadow Me Next, a podcast where I take you into and behind the scenes of the medical world to provide you with a deeper understanding of the human side of medicine. I'm Ashley, a physician assistant, medical editor, clinical preceptor, and the creator of Shadow Me Next. It is my pleasure to introduce you to incredible members of the healthcare field and uncover their unique stories, the joys and challenges they face, and what drives them in their careers. It's access you want and stories you need. Whether you're a pre-health student or simply curious about the healthcare field, I invite you to join me as we take a conversational and personal look into the lives and minds of leaders in medicine. I don't want you to miss a single one of these conversations, so make sure that you subscribe to this podcast, which will automatically notify you when new episodes are dropped, and follow us on Instagram and Facebook at Shadow Me Next, where we will review highlights from this conversation and where I'll give you sneak previews of our upcoming guests. What if the nurse in your emergency room also happened to be the hilarious, wildly relatable voice behind one of TikTok's most beloved healthcare accounts? Today on Shadow Me Next, I'm joined by Brock Kemp, an overnight med-surg warrior turned ER nurse, who also happens to be the creator behind Scrub Laddie, where comedy meets catharsis for thousands of healthcare workers. From mowing lawns and fixing storage units to managing medical chaos and patient codes, Brock's path into medicine is unique, and that's what makes it so interesting. We'll talk misconceptions in nursing, the power of laughter in preventing burnout, and what it's like to go viral for reenacting the awkward chaos of hospital shift change. Plus, if you've ever wondered what lateral mobility in nursing really looks like, or what it's like to drag an unconscious patient from a car mid-code, you're in for a story. Please keep in mind that the content of this podcast is intended for informational and entertainment purposes only and should not be considered as professional medical advice. The views and opinions expressed in this podcast are those of the host and guests and do not necessarily reflect the official policy or position of any other agency, organization, employer, or company. This is Shadow Me Next with Brock Kemp. Hi, Brock. Thank you so much for joining me on Shadow Me Next. I am thrilled to have you. You have an incredible platform. And more importantly, you are a nurse. And I just think you are godlike and a hero. And I'm so grateful for our nurses.
Thanks. I'm excited to be here.
So tell us, when you started looking into medicine, did you know you wanted to go into nursing right away? Or was it something that was more of a journey to trying to figure out?
It was definitely a journey for me. So I can remember being like a little kid and we would make like these little posters and stuff. And they were like, what do you want to be when you grow up? And I was like, I remember I made mine as like a doctor with one of those, the eye doctors with the circle thing on their forehead, because I didn't really know what doctors did. I just saw like pictures like that's what doctors wear, so I was like, I want to be a doctor, and then you kind of like grow up, you go through life. So I never worked like in a hospital before going to nursing school. A lot of people like, they have family or something, or they work, growing up in a hospital. Nobody in my family was a nurse outside of my grandma, and she was a surgical nurse. So she liked it a lot, but like she was obviously a nurse like years and years ago. It's obviously way different now. So it really wasn't like similar to what I do now at all.
Mm-hmm.
But I went to school and I was like a general health studies degree. And I went to school because that's where my sister went. And it was like, this is just what we're supposed to do. We're supposed to go to school. So I'm going to go. I went to Eastern Illinois University. So go Panthers. And I was like a general health studies degree. And I got through 1 year of general health studies, which was all just like basic biology and stuff. You sort of like look around, you're like, okay, what are these people all doing when they graduate, And a lot of them are like, a lot of them becoming like health ed people at schools, or like some of them go into like community public health, or they just like nothing was really like clearly defined, like what you're going into. So my mom actually was the one who was like, hey, I think you should consider nursing. And then I had another friend he was a little bit older than me, and his wife was a nurse, and he was like, she loves it. It's super flexible. You should consider it. So I was like, you know what? I'm going to give it a shot. And I went into nursing school, and it was weird because our school had like this, like Eastern was its own school. And then next to Eastern was this itty bitty little college called Lakeview College of Nursing. And you could like basically like segue into this Lakeview thing. And that's what I did. So I was able to like transfer my credits over there. And it was like it was like a 2 to 3 year bridge program essentially to get
Hmm.
your BS in. So that's what I did. And before I went into healthcare, I had worked on storage units. So I worked at a storage unit facility and I fixed doors. And then I was like a mower and I mowed people's grass and like, so I had no idea what I was doing at all.
I love too the visual of that like silver thing on the doctor's. Where did that even come? Have you ever seen one of those in real life? I have not ever seen
I
a
think it's an
silver shiny.
ophthalmologist, isn't it?
I guess so. I don't even know. The
Yeah.
thing on
Well,
their forehead.
I'd tell you where it came from or where I got the idea as a kid is I used to play that game Super Smash Bros. You ever heard of that game? And
Yes.
there's that one character named Dr. Mario, and I always thought he was so cool. And he had that on his head. So I was just like, I guess this is what doctors use, you know? So
It's so funny. This is actually a cool segue, and I was going to save this for later, but let's talk about it now.
sure.
Misconceptions in medicine, right? Misconceptions about what people do. Like in our head, that's what doctor means. I mean, we were little, of course. Now we're older and we're in medicine. We know that doctors have other gizmos and gadgets that they use. But for you, especially, have you run into misconceptions in your work? And what, I don't know, what would one of those look like?
Well, yeah, I mean, obviously, well, so I'm a male nurse, which obviously is a huge misconception, like right off the bat.
Yep.
And like, I mean, it's just a female dominated profession, which is, I mean, that's a whole nother topic with a lot of history to it. And
Mm-hmm.
I mean, I'm a male nurse, so I feel like when I walk into the room, people always think I'm a doctor. They're always like, oh, the doctor's here, and I'm always like, okay, hey, time out, I'm actually your nurse today. Some of our PAs are more like my age. So I'll walk in with them and they'll like start talking to me like I'm gonna like be their provider. And I'm just
Right.
like kind of like pointing over, like, you want to talk to her. And I feel bad because like I feel like maybe subconsciously they're kind of like irritated, and I get it because it's like I'm sure I mean you're a woman, you get it, like it happens.
It does. It does. But this is a great conversation. In medicine, obviously, we have to have a sense of humility and we do have to have a sense of humor. Obviously, you have the best sense of humor. Um, and patients have an idea of what they expect, not just who they're expecting to treat them, but also how they're expecting to be treated. And so I
Yeah.
think it's just a really easy example of managing patient expectations as soon as you walk into the room. It's a vast network of team members that serves these patients, and it's fun to see the roles that everybody plays. I'm sure the PAs just giggle, and some days I'm sure they'll say, "Brock, take it away. This one's yours." Another thing that you might have realized or recognized or experienced is the patients will behave one way for
Totally.
you. And then a PA, MD, DO, a PT, OT, whatever, will walk in the room and the patient behaves in a totally different way. And, it's something that I don't think we address that often. Have you experienced that?
100%.
Yeah.
And I think now that you mentioned that, like it's like people choose who they want to trust. It's been both sides where I've had people who
Mm.
have had negative experiences with physicians and they feel like they can trust a nurse, and so they're like friendly buddy buddy with you, and then the doc comes in and they're kind of more closed off. But I've definitely had it the other way too,
Mhm.
where the doctor will say something that you said like 6 times, and they're like, "This is the first time I'm hearing this." You're just like, "Gosh," like I told you this like 5 times.
It brings up a really excellent point. It's a great cautionary tale and a really great recommendation to these patients. If you feel like there is somebody on your medical team that you are jiving with, somebody that you trust, somebody that you respect, somebody that feels like they really are listening to you, get with that person. They are going to advocate for you, whether they're a nurse, um,
Oh, you're talking
uh,
about from like a patient side.
from a patient standpoint. Yeah,
Oh,
absolutely. Yeah, from a patient standpoint, if you feel like your nurse is listening to your concerns, let them know that and say, "Hey, can you advocate for me?" We are all working as a team,
yep,
with their best interests in mind. Oh my gosh, so good. Okay, wait, I want to pivot again. You mentioned med-surg overnight. That's where you started?
yep.
Wild. Okay. Was that hard? I mean, is that a normal thing for nurses to jump into straight out of school?
Yeah, man. They're typically hardest to staff, I think, because I think like med surg is like it's just such a weird. It's a hard unit, and it's not like a lot of like fancy critical medical stuff. But what happens is like you send people up from the ED and they have no specific diagnosis. So a lot of like older folks go there and they're there for pneumonia or they're there for like failure to thrive, But these patients have like very, very high needs. So it's like, well, it's not like medically like difficult in terms of like treatments and stuff, it's just a lot of hands-on work.
A lot of
So
work for you guys, I would imagine.
yeah, totally. And they all sundown at night, and nights on med-surg is just like it's like a zoo, because it's like 9:30 comes around and it's like sweet little grandma who was in the bed is now like jumping up and down, and like it's like, okay, so sorry, I'm gonna pivot a little bit too. It's like when I got into medicine, that for me was like, and I was like, what is going on? Because I had never been exposed to it. I didn't even know that people could do that. You know what I mean? Like
Yep.
it's like Dr. Jekyll and Mr. Hyde, like overnight, like you turn into like this different person because I don't really know the science behind it. Like your brain is just doing this to you. And then 5 a.m. comes around and it's like, sweet little Susie again. Like, and you're just like, Susie, do you remember like last night you were like yelling at me and grabbing me and all this stuff? And they just have no clue. But yeah, a lot of new nurses started on med-surg, which I was really thankful for. I was not great at school. And like I said, no medical background really. So it was a good foundation, good starting ground. So I was there for like 2 years. From there, I went to Mayo Clinic in Minnesota, and that was a really cool experience. So they had like a really thorough like rehab facility there. Like a lot of people, when they think rehab, you think like nursing home, but you've got to think in terms of like, this is Mayo Clinic, so they're going to make like this amazing one. So it was a stroke and spinal rehab, and it was really, really neat. It was a cool experience, like because you're just working with really debilitated stroke patients or spinal cord injuries. I did that for a few years, so that was sad, but also like very rewarding at the same time because the patients would stay for sometimes like months. And, some of them saw like a lot of progress. Some of it was more like, hey, this is your life now. We got to figure out how to make this work for you. So that was a cool experience. From there, I was like, I want to try something else. So I went into research nursing for a very brief period of time.
Very brief.
Yeah. I mean, you kind of like, when you're a nurse and all you know is like bedside, you're like, I'm going to try something that's not bedside. So I went into this research thing, and I was kind of like a research coordinator, you could say, so people going through clinical trials, and it's a lot more of like an office job. And I did that for just about a year. And I basically learned like, okay, I actually really liked the flexibility of the 12-hour day. I like being on my feet. I kind of like the hands-on care. So did that, realized that wasn't for me, went back to bedside, went to neurosurgery, post-op neurosurgery for about a year. And then that was, again, very similar to like the stroke thing. So a lot of those patients are coming in with like cranies and stuff. So they're like high like hands-on needs. Like they're like turns, and they have trachs, and they're tube fed and all that stuff. And then from there went to the ER.
Which is where you are now.
Which is where I'm at now. It took me a while to get there. And like once I started in the ER, I realized like I really liked it. And my wife was even like, okay, like you definitely should stay here because you're like a way happier person now that you kind of like found your area, which I think speaks to like nursing and medicine. Is it's like every area is so different, and you find one that you like, you're like, oh, like this might be my thing, So I've been very happy working in the ER. I love it.
I'm so glad to hear that. And gosh, there is so much goodness that you just told us right there. Particularly, not every bit of medicine is going to be for every person,
right?
And that's okay. I have some students that'll come and shadow me and say, well, Ashley, like, I cannot stand the sight of blood. I will pass out. I'm like, that's okay. There is a place for you in medicine. If you still want to serve people in this capacity, maybe not working in the ER. Sure, you see
there's
plenty
a lot of blood in the ER.
Let's discuss quality questions, and please keep in mind that there's more interview prep, such as mock interviews and personal statement review, over on shadowmenext.com. There you'll find amazing resources to help you as you prepare to answer your own quality questions. So Brock and I did not have a chance to discuss a quality question, but what he's talking about here brings up an excellent point. We often talk about the specialties or roles in medicine that we're drawn to, but the truth is not every setting is going to be the right fit for everyone, and that's completely normal. So this is one interview question I'd love to hear. Describe a setting or situation in healthcare that you think might not align with your strengths or personality. How would you navigate that during your training or career? There's really no wrong answer here. It's more about being honest with yourself and understanding where you can grow or where you might better thrive in a different environment. I want to talk about lateral mobility because, you're describing all of these very cool and also very different jobs that you've worked over the course of at least a few years, maybe
Hmm.
10-ish. And a lateral mobility is something, it's like a buzzword for PAs. Like students love in interviews, they love talking about they want to be a PA because of the lateral mobility. And that's true. And obviously PAs have fantastic lateral mobility. But tell me a little bit about what that looks like when you switch from um, perhaps working in med-surg to moving on to the next one. What is it? Is it really difficult? Is it really time consuming? Stressful?
Oh man, I have a lot to say about this. Okay, so lateral, I think it's like it's both good and it's bad. So and I'll unpack that a little bit, but like obviously being a nurse is great because you can move to different specialties, you know. With that being said, there's something very, very valuable about people who stay in a specialty. And I feel like as nurses have, as we have more travel nurses, as we have more just like movement and people staying in positions longer, you're starting to lose that a little bit, you know? And so like the people that are like cemented in a unit who've been there for let's say 15 plus years, like those people are few and far between, but they're like highly valuable people, because
Right.
even if you were going from exact same specialty to the same specialty at a different hospital, there's still so many like little nuanced things that are going to be different that you need like somebody who actually knows, hey, this is what's going on, like this is how this works, because it's just a new place, even if it's the exact same specialty.
Mm-hmm.
So that being said, I think it is awesome. You get to move around. I think it like gives people like time to. Okay, so the process is once you start a new job, usually they put you on orientation and you basically like shadow and work with another nurse for about 3 months.
Oh, that's longer than I was expecting.
Yeah, usually if you have like experience going in, they'll cut you down, but like most of my switches have been about the same where you're basically shadowing and being precepted for about 10 weeks
Wow.
to 12 weeks and you can
Mm-hmm.
expedite that a little bit if you feel like, hey, I'm getting it, like I've done this or whatever. But it's a long process and those 3 months are pretty grueling for you as the learner. Like it can be fun and
Mm-hmm.
it's new, but it's really tiring.
It's overwhelming and it can be really stressful. And I think a lot of the thoughts that go through your head are, have I made the right decision? Is this for me? Am I going to screw all of this up? you know,
Totally. Yep. And that's kind of the role of the preceptor is like you're just kind of like, hey, listen, like we want you to learn how to do this. I'm just here to make sure that you don't make a monumental mistake, you know?
exactly. Exactly.
Mhm.
It's good. It's teaching. It's very important. Somebody taught you. It's good to lean back into these newer hires. Tell me about a day. Like what does a day in the ER look like for you?
Yes, I love talking about this. So I view the ER as like we're less like independent nursing in our own silos. We're like a giant machine, so to speak, and our job is to like serve this community, with their various emergencies and stuff. So we're just like this
Mm-hmm.
churning machine, and it's like we get tons of people come in. So let's say you start your day, you walk in there, and I'll get like my bed assignments. So it'll be like, hey, Brock, you're gonna have beds 1, 2, 3, 4. Let's just say 1, 2, 3, 4.
Mm-hmm.
And so as the day goes on, those beds are going to get filled up with different things. Either ambulances come in and they drop somebody off, and or somebody comes in the waiting room,
Mm-hmm.
and they come in and you pull them back to a room. So pretty much the day just looks like you fill up your rooms, you do your assessments on them, you get doctor's orders, and you start executing orders. And those people can be either highly critical or they could be super not critical at all. Like they could come in with like tooth pain, like legitimately, like they'll come to the ER with tooth pain and you're like, man, I really think you should have gone and seen a dentist for this. But like sometimes we'll give them like antibiotics. Maybe they've got like an abscess in their mouth or something. But the on the flip side of it is like you never know what's coming in. Like just the other week, I remember I was just walking down the hall and like somebody like burst out of the lobby and they're like, "There's a guy, he's unconscious in his car. Like grab a bed." So like you're just, when that happens, you're just like fight or flight immediately. And you're like, oh my God. So I'm like scrambling around looking for a bed, like a cot, run this out to this guy's car. He's coding in the passenger seat of his
What?
wife's car. So then we basically just like hoist him out of there, toss him in this bed, take him right back, and we're doing CPR.
Literally so wild. And he's probably in the room next to the man with a toothache.
Yeah, right. Yeah, you know what I mean? And like people, it's funny too, because like patients down there, like the rooms are very open, and so people down there can like see a little bit like what's going on, and they can tell like, oh man, like somebody is not doing so hot because everybody's like frantically like running past their door and like grabbing a crash cart and all this stuff.
I love it. We have a phrase around here that's medicine is not Grey's Anatomy, right? So like what you see on TV probably isn't what is happening in real life, but it sounds like in the ER sometimes there is some good drama and you see some really unique and
Totally.
TV worthy things. Yeah.
Yeah, totally. Yeah, you're totally right. Medicine, the TV shows are terrible. The only one that was semi-accurate for a little bit was the pit. Obviously, everyone talks about the pit, and the pit was cool because like you see the treatments that they do, and you're like, wow, that's exactly like we do it. Like they did their
Right.
research. My only thing against the pit, I actually made a post about this, but my only thing against the pit was just like the acuity that the pit sees is insane. You know what I mean? Like it's like one day they're like, I remember the episode they're doing like a emergency fasciotomy, and then the guy's having a heart attack in the hall bed, and you're just like, okay, like this is kind of outrageous here, but it's drama. It's like
It
Hollywood drama.
is. It is. Let's talk about you mentioned your post. So you have this amazing Instagram, TikTok presence. Scrub Laddie, tell me what the most surprising and rewarding aspect of doing this social media thing that you do is.
Sure, I'd love to. So it's yeah, social media is funny because you get popular on it, and you're just like, oh, I guess I'm popular now on social media. And I originally I remember it was COVID, and that was when like TikTok kind of was like becoming a thing.
Mm-hmm.
And it's COVID, so you have nothing to do. And I was like, I'm gonna download this app. So I downloaded it, and I was working by the way through COVID. But I download the app, you start like scrolling on it, you're like, oh, this is funny. Like this is, you start to enjoy it. And then I was like, I'm gonna make some videos. So then I made the most random videos you've ever seen. Like, you know what I mean? Just like stupid stuff. Like one time I made a video like my wife like walking out on me. It was all mock scenario, but she's
Of
leaving me.
course.
She's leaving me, and I go to the fridge and I grab a beer, and it's like the celebratory music, and like beer is my new wife. Like that was my that was actually like one of my first viral videos I ever made was that video. And then so anyways, I was just I played around with it for a few years, and then like honestly the nursing thing took off because I remember I got my very first like very successful videos. I had to give report to this nurse who was like a pain in the butt to give report to. Kind of
Mm.
like you tell them stuff and they're just asking all these questions that are just really unrelated. Like they really want to make some nurses are like that. We can talk about that eventually, but like they really want to make you feel dumb and like not great. So I went home and it was actually kind of like out of frustration. It's like, I'm just going to make a skit about this. So I like made this skit and it just like erupted. Like people were like, oh my God, like I know a nurse like that. Like that nurse sucks. And so that's kind of where Scrub Laddie was born. And then it just became like these medical scenarios. And my goal was like, I want to make them funny and engaging because that's people like to watch that. You have to like captivate your audience. But like at the same time, I have like these points and these messages I'm trying to like get across. And it's just kind of been like that. So it's been like different medical scenarios whether it's like some of them are sad, some of them are like really realistic, some of them are just like funny, like a super non-compliant diabetic patient. I have a character, he's a fictional character, his name is Rick, and it's just like, oh, Rick's back at the hospital again because his blood sugar is 8,000 and he's going to get another toe amputation, which you've seen patients like that, it's like,
Yes. Oh, yes.
and I think, sorry, to answer your question, the rewarding part is like it's grown and people like it. And the one thing that nurses say to me all the time, like they'll message me, is like, hey, they're like, hey, we really appreciate what you do because your videos make us feel like seen. And people are like, this feels almost like therapeutic for them. So then I'm like, okay, that's pretty cool because some of social media is just garbage. But it's like if you can kind of, in my mind, it's like if it can be semi-educational, if it can be therapeutic for people, like that's obviously like a huge win. And I think that's cool.
No, absolutely. And that's exactly how I found you in the first place and why I just fell in love with your content and you so much is because it is. I mean, you're turning these very realistic situations into something somewhat humorous, although I'm sure many of them are just direct verbatim from the exact situation as they were.
Yep.
But it does. It's all very supportive of healthcare workers, and it allows people to be seen that otherwise might just feel frustrated. And as we both know, that does lead to burnout. And if you have a friend, even if it's somebody that you follow on Instagram or TikTok, that you can kind of laugh at with them, thanks to you, it helps. It really does help. And not just in medicine. I think this is, I think this is across the board. So thank you for what you're doing with your platform, Scrub Laddie. It is just, I love it so much.
Appreciate you saying that. I mean, obviously it's a lot of fun for me, so I appreciate that you enjoy it. I love doing the videos. It's been super fun to be doing it for the last year or so.
And you mentioned cathartic too. And I think it is so important for us to find those outlets, whether it's related to our job or not. You with Scrub Laddie, me with Shadow Me Next, these are ways that we feel like we can continue to give back in a capacity that is also really enjoyable for us. So I appreciate it. Okay, last question. Before we wrap up, Brock, tell me one piece of advice that you wish somebody would have said to you that maybe would have either pushed you one direction or the other.
I think I maybe like shadowing would have been helpful. It's funny, this is Shadow Me Next. So we're kind of
perfect.
Shadowing. But
yes.
I think shadowing would have been helpful. And I should have spent more time, I think, on the front end going like understanding on the front end, like, okay, medicine at all these different areas looks different. Every floor is different, and I should shadow and see like which one attracts me the most, because I think my advice to somebody would be like, you're going to find the area that you like. It exists out there. It just, like, for me, it took some time to get there, but it's out there, and like you'll find it. And like, people talk about like the 60-40 rule, like 60% enjoy your job, 40% don't. Like, obviously at the end of the day, it's still going to be work and it's not super fun, but regardless, you still got to go to work. You still got to make money. You still got to survive. So it's like, just give it a chance to find that area that you actually enjoy, because it's out there.
I think that's perfect. Oh, that was beautifully said, and absolutely correct. Obviously, it's what we're all trying to do: just showcase a day in our life and a day in the lives of others, and help others find their place and find their role and find what is meaningful and what they're passionate about. So, thanks so much, Brock. Brock with Scrub Laddie, you are amazing. I appreciate you taking the time.
Thank you for having me. Good to meet you.
Thank you so very much for listening to this episode of Shadow Me Next. If you liked this episode, or if you think it could be useful for a friend, please subscribe and invite them to join us next Monday. As always, if you have any questions, let me know on Facebook or Instagram. Access you want, stories you need. You're always invited to Shadow Me Next.